So should I start?
Yes.
Okay. So some echo. For the Thailand, can you turn off your microphone so that there's less no echo? Okay, very good. Okay, good morning everyone. There's echo.
Morning. Yeah.
Hi, my name is Quinn. I think there's still echo. For the Thailand, can you turn off your sound on mute? Good morning everyone. Hi, my name is Quinn from HelpAge International. Today, I will be the moderator for this webinar entitled The Role of Older People Associations, or OPA, in Age-Inclusive Disaster Risk Reduction, or DRR, and COVID-19 response in ASEAN region. Before we start, I would like to do a quick and simple intro energizer. Here are the instructions. If I call your country name, can you turn on your camera? And when I count 1, 2, 3, can you say hello in your country language? Okay? Before we start, can you turn off your camera? Okay, turn off your camera. Yes, very good.
Tắt camera này.
The first country in my list is Indonesia. Can you turn on your camera?
Hello.
Wait. In the count of 1,
Hello.
2, 3. How do you say hello in your local language?
Hello. Hello.
Okay. Followed by the Philippines. 1, 2, 3.
Kumusta po kayo?
Okay, very good. Now from Vietnam. 1, 2, 3. Vietnam? Are you there? 1, 2, 3. Can you say 1, 2, 3?
Làm sao?
Xin chào, right?
Xin chào.
Okay, I'll say it. Okay. The next country, the final next country is Thailand.
สวัสดีครับ
สวัสดีครับ
And the last is other countries. Hong Kong.
Hello,
Oh, from Hong Kong. How did you say in Cantonese?
Jalsan.
Jiaosan. Okay, Jiaosan. Okay, very good. So we have just done our quick energizer. This webinar is organized by 4 organizations based in the region, which are 1, from Thailand, the Foundation for Older Person Development, or FOPDEV. 2nd, from the Philippines, Coalition of Service for the Elderly Inc., or COSE. 3rd, from Indonesia, Yakkum Emergency Unit, or YEU. And from Vietnam, HelpAge International in Vietnam. This webinar is made possible with the very generous support from Prudence Foundation's support. The objective of this webinars are to promote practical knowledge and experience in age-inclusive DRR and COVID-19 emergency response among OPAs and NGOs in the region through sharing of best practice, and to discuss way forward on how to further promote more age-inclusive DRR and emergency response in ASEAN countries and at regional level. This webinar is divided into 4 parts. Part 1 is the intro and the welcome. Part 2 is the country sharing of best practice. Part 3 is the way forward. Part 4 is the conclusion and clothing. Now, I would like to invite Mr. Mark Fancy, the Executive Director from Prudence Foundations, to give the opening remark. Mark, the floor is yours.
Thank you very much. I will try and speak very slowly because I understand that today's session is being simultaneously translated. So if I pause, it is purely to help the wonderful people who are doing the translations. Good morning, everyone, and thank you very much for the invitation to today's event that aims to explore, promote, and share experiences on the role of older people in age-inclusive DRR, or disaster risk reduction, as well as COVID emergency response across ASEAN. My name is Mark Fancy. I'm the Executive Director of Prudence Foundation, and Prudence Foundation is the community investment arm of Prudential across the whole of Asia and Africa. And our mission is really focused around securing the future of communities by focusing on aspects of education, health, and safety. Now, as part of this mission, and very much since 2013, we've been involved in various aspects and programs that specifically address disaster risk reduction, as well as disaster relief and recovery. And as everyone on this call is fully aware, DRR remains a crucial area of work across the ASEAN region. And this is no doubt only going to increase with the continuing and ongoing impacts of climate change. Now, our experiences and programs have extended from mass scale educational awareness programs around disaster preparedness to implementing safe school frameworks across vulnerable countries throughout the region, as well as partnerships with FOPDEV, HelpAge International, around looking at the role of the elderly and the role the elderly have in disaster risk reduction programs. And over the past few years, this work has extended, obviously, to support efforts around COVID-19 with a specific lens on the elderly communities who are most at risk or are the most at-risk segment of society. And COVID has introduced a new dimension of issues around efforts around disaster risk reduction. How to manage disaster relief amidst the ongoing COVID pandemic has brought across new challenges that many countries are having to deal with right now. And this is unprecedented. We've never been in a pandemic, it's certainly not in our generations, and we've never been in a pandemic whilst there are ongoing crises or disasters happening across various countries. Now, I'm sure it'd be very interesting to hear from all the participants, and FOPDEV will no doubt share on some of the programs we've supported in greater detail during the course of this seminar. But we're very proud to have supported their efforts to date, which have reached over 20,000 direct beneficiaries, and have also generated a greater awareness and engagement on this specific subject. And there are many learnings that can be shared and have been learned throughout this journey, which no doubt we'll share today. Our support to FOPDEV was initially focused and implemented in North Thailand, and we are delighted to have seen this work expand both into the national level, but also at the regional level and within the ASEAN community, with many NGOs and CSOs now engaged, which brings greater awareness and positive impacts to the elderly communities, and ensuring they're not just simply victims, but they're actually active participants in the solutions that disaster risk reduction aspires to address. So we applaud today's initiative in bringing together the various organizations who share similar values and objectives and can share their experiences and best practices to hopefully strengthen the greater collaboration across the region. So I wish everyone a successful and fruitful seminar. I look forward to hearing all the experiences and shared stories, and hopefully there'll be some great learnings that can move us forward as we proceed with our endeavors. Thank you very much.
Thank you very much, Mark, for your excellent speech. Now I would like to invite Mr. Boon Tham. He is the Director General of the Department of Disaster Prevention and Mitigation to give his speech.
เนื่องในโอกาสวันจัดการภัยพิบัติของอาเซียนและวันลดความเสี่ยงจากภัยพิบัติสากลกรมป้องกันและบรรเทาสาธารณภัยในฐานะหน่วยงานหลักในการดำเนินงานด้านการลดความเสี่ยงจากภัยพิบัติของประเทศไทยขอร่วมเป็นแรงขับเคลื่อนในการรณรงค์ให้ประเทศไทยและประชาคมโลกมีความปลอดภัยอย่างยั่งยืนองค์การสหประชาชาติและอาเซียนได้พร้อมใจกันกำหนดให้วันที่ 13 ตุลาคมของทุกปีเป็นวันที่ทุกฝ่ายจะร่วมมือร่วมใจสร้างความตระหนักรู้ตลอดจนร่วมกันแสดงเจตนารมณ์ในการดำเนินงานเพื่อลดความเสี่ยงจากภัยพิบัติและสร้างวัฒนธรรมแห่งความปลอดภัยโดยในปีนี้ประเด็นที่จะร่วมรณรงค์และขับเคลื่อนการดำเนินงานตามกรอบเส้นใดคือตัวชี้วัด F การเพิ่มประสิทธิภาพความร่วมมือระหว่างประเทศให้แก่ประเทศกำลังพัฒนาโดยให้การสนับสนุนที่เพียงพอและยั่งยืนแก่ประเทศสมาชิกในการดำเนินงานตามกรอบเส้นใดภายในปีพ.ศ. 2573ประเทศไทยตระหนักถึงความสำคัญของความร่วมมือระหว่างประเทศแบบหุ้นส่วนในการจัดการความเสี่ยงจากภัยพิบัติรวมถึงการพัฒนาระบบการประสานความช่วยเหลือด้านมนุษยธรรมที่มีเอกภาพและการยกระดับการปฏิบัติงานด้านมนุษยธรรมให้เป็นไปตามมาตรฐานสากลโดยได้บรรจุเป็นหนึ่งในยุทธศาสตร์หลักภายใต้แผนการป้องกันและบรรเทาสาธารณภัยแห่งชาติจากนี้ไปทั่วโลกอาจจะต้องเผชิญกับความท้าทายรูปแบบใหม่ๆที่ไม่เคยคาดคิดมาก่อนอีกมากซึ่งจะเป็นอุปสรรคต่อการพัฒนาตามเป้าหมายการพัฒนาที่ยั่งยืนในระดับประเทศสิ่งสำคัญคือการมีระบบการจัดการความเสี่ยงจากภัยพิบัติที่ดีรวมไปถึงการมีความร่วมมือระหว่างประเทศที่เข้มแข็งเพราะภัยพิบัตินั้นเกิดขึ้นอย่างไร้พรมแดนและอาจส่งผลกระทบต่อเนื่องไปได้หลายภาคส่วนดังเห็นได้จากกรณีผลกระทบของการแพร่ระบาดของโรคติดเชื้อไวรัสโคโรนา 2019 อย่างไรก็ตามแต่ละประเทศมีความสามารถในการรับมือกับภัยพิบัติที่แตกต่างกันดังนั้นความร่วมมือในการขับเคลื่อนการพัฒนาโดยมีทิศทางเดียวกันจึงเป็นสิ่งจำเป็นเพื่อป้องกันความเสี่ยงใหม่ลดความเสี่ยงที่มีอยู่เดิมและมุ่งสู่การฟื้นฟูที่ดีกว่าเดิมอย่างยั่งยืนโดยไม่ทิ้งใครไว้ข้างหลังการจัดการความเสี่ยงจากภัยพิบัติเป็นภารกิจที่ต้องอาศัยความร่วมมือของผู้มีส่วนได้ส่วนเสียทุกฝ่ายและต้องร่วมมือกันเพื่อลดความเสี่ยงจากภัยพิบัติควบคู่กับการลดผลกระทบและการปรับตัวต่อการเปลี่ยนแปลงของสภาพภูมิอากาศเพื่อบรรลุเป้าหมายการพัฒนาอย่างยั่งยืนสร้างคุณภาพชีวิตที่ดีมีทรัพยากรเพียงพอต่อการดำรงชีวิตและส่งต่อโลกที่มีความหลากหลายทางชีวภาพและมีความสมดุลของระบบนิเวศทางธรรมชาติให้กับคนรุ่นต่อไป
Now I would like to invite Mr. Sawang Galkanta, the Executive Director of FOPDEV, to give his speech on the role of OPAs in disaster risk reduction.
สวัสดีครับ Good morning Mr. Mark Fancy Executive Director of Prudence Foundation Hong Kong คุณบุญธรรมเลิศสุกเกษมจากกระทรวงมหาดไทย and everybody Mr. Quinn Chan from HelpAge International Asia and the Pacific programs colleagues and friends welcome to FOPDEV virtually not face to face but it is good that we have opportunity to get together again. It's my privilege to be here this morning. Despite the COVID-19 pandemic, which prevent us to get together, but this is the way out, how to step over the COVID-19 to have words together. That's a good. As you may know that the people age 60 and over, more than 50% of the people age 60 and over in the world live in Asia. And that is the significant that the inclusion of older people in all kinds of society to social development, if you like, and especially in this other risk reduction. In Thailand, as with the kind support from Prudence Foundation since 2012, we work hand in hand with HelpAge International and its network across the region on disaster reduction. So we all signify the role of older people, particularly in get involved in the disaster reduction activities in all kinds. So I would like to thank all the networks that you are here today, that we can get together and to drive the advocacy on the disaster risk reduction to get safe for the people in this region, not only Chiang Mai or Thailand, also in ASEAN, particularly in across the network of HelpAge International in this area. In Thailand, you may learn that the OPA play a great role to work with the Department of Prevention and Mitigation and their own community, and then educate the young people how to observe the disaster or whatever that comes to them in all season. For example, just right this time, the end of the rainy season in Thailand, and get a lot of rapid flood all over the country. So not only just Chiang Mai in the north that we focus on this, and we expanded our work into the 4 regions. For example, in the northeastern Thailand, in the southern parts of the country, in Andaman coast, and in central around Bangkok, like Ayutthaya, Lopburi, that all network that we work together on this. And I would very much like to thank the Prudence Foundation to support us to do this, to enable us to expand our work to greater area. And we also invite HelpAge International Network in the region to work together as we used to work in other issues to address the hardship, the problem and needs of the older people, especially the vulnerable group, to have better living condition in their community. Thank you very much and welcome to FOPDEV again. สวัสดีครับ ขอบคุณครับ
Thank you, Mr. Sawang. We have just completed part 1. Now we are in part 2. Part 2 is the country sharing of best practice. Part 2 is structured as follows. We will first have 4 country presentation, followed by a Q&A session. Therefore, during the country presentation, if you have question, please write it down in the chat box and indicate what country your question is directed to. So, first on my list for country sharing is from Indonesia. I think there will be.
Selamat pagi, saya Dina Rizky, saya dari Yakkum Emergency Unit. Dalam 10 menit ke depan, saya akan bercerita dan berbagi pengalaman terkait dengan bagaimana YU mengorganisir kelompok lansia melalui pendekatan kelompok lintas generasi. Yakkum Emergency Unit sendiri berdiri pada tahun 2001, di mana mandatnya adalah respon bencana, pengurangan risiko bencana, dan climate change. Dan tentunya kami bekerja dengan prinsip-prinsip kemanusiaan seperti imparsial, kemudian partisipatif, serta inklusi. Di Indonesia khususnya, banyak permasalahan yang dialami oleh lansia. Yang pertama yaitu perekonomian. Bagaimana lansia itu tidak mendapatkan kesempatan untuk bekerja sehingga produktivitasnya itu menurun. Yang kedua itu tentang kemiskinan. Banyak kemudian lansia yang menjadi miskin sehingga mereka tidak bisa memenuhi kebutuhan dasar serta gizi yang seharusnya diperoleh. Dan yang ketiga itu adalah terkait dengan kesehatan. Di masa tuanya, kita tahu bahwa lansia sangat membutuhkan akses terhadap kesehatan. Kesehatan secara fisik maupun mental itu menjadi menurun. Dan kemudian banyak yang membutuhkan alat-alat bantu seperti kursi roda. Dan yang terakhir itu adalah kehidupan sosial. Bagaimana kelompok lansia banyak yang mengalami kekerasan karena dianggap menjadi beban dari keluarganya. Hal-hal inilah yang kemudian menjadi kerentanan terutama di masa bencana. Pada tahun 2018, YU bersama dengan HelpAge Internasional melakukan rapid need assessment di Palu. Ternyata teridentifikasi bahwa 19% lansia perempuan dan 10% lansia laki-laki itu tidak memiliki KTP. Padahal KTP merupakan kebutuhan dasar untuk masyarakat dapat mengakses bantuan-bantuan lainnya, serta untuk mengakses BPJS. Yang kedua, ditemukan bahwa 63% lansia perempuan dan 48% lansia laki-laki itu bergantung kepada keluarganya, terutama untuk pemenuhan hak-hak dasar mereka. Dan yang terakhir adalah terkait dengan 42% lansia itu merupakan lansia yang disabilitas, baik itu disabilitas fisik maupun hambatan-hambatan lainnya. Hal ini artinya perlu ada dukungan-dukungan yang diberikan kepada lansia supaya lansia dapat melakukan pengurangan resiko bencana sebelum terjadinya bencana. Untuk mengurangi kerentanan lansia, oleh sebab itu Yakkum Emergency Unit mengorganisir kelompok lintas generasi supaya melalui kelompok lintas generasi dapat dipaparkan terkait dengan pengurangan risiko bencana yang inklusi. Sampai hari ini Yakkum Emergency Unit telah mengelola sekitar 28 kelompok lintas generasi di Indonesia. Kegiatan-kegiatan yang dilakukan oleh kelompok lintas generasi yang pertama yaitu tentang kesehatan. Mereka membuat olahraga rutin, kemudian memetakan siapa yang belum memiliki BPJS dan mencarikan aksesnya. Dan mereka juga melakukan pemeriksaan kesehatan melalui door-to-door secara rutin. Yang kedua adalah terkait dengan sosial. Bagaimana kelompok ini melakukan kegiatan swabantu, gotong royong, serta berpartisipasi dalam sosial budaya yang ada di wilayahnya. Yang ketiga adalah tentang pengurangan risiko bencana. Bagaimana kelompok lintas generasi terlibat secara aktif di dalam desa tangguh bencana dan berpartisipasi untuk melakukan evakuasi, kegiatan kajian resiko, memetakan ancaman, memetakan kerentanan serta kapasitasnya, sosialisasi terkait dengan tas siaga, dan bagaimana evakuasi untuk lansia. Dan yang terakhir adalah ekonomi. Bagaimana melalui kegiatan mikrokredit, lansia diberikan ruang untuk dapat melakukan peningkatan perekonomiannya, yang mana ini merupakan hak sebagai lansia. Berikut ini adalah Bu Trisni yang merupakan salah satu anggota dari kelompok lintas generasi yang akan berbagi pengalamannya terlibat di dalam kelompok lintas generasi.
Assalamualaikum warahmatullahi wabarakatuh. Perkenalkan, saya Sutresni Nurhartini dari KLG Agung Makmur, Kalurahan Margo Agung, Kapanewon Seyegan, Kabupaten Sleman, Yogyakarta, yang mana kami mewakili KLG yang lainnya. Dalam acara ini ingin menyampaikan yang kami lakukan pada masa pandemi COVID-19. Sekilas tentang KLG Agung Makmur, di mana merupakan salah satu KLG angkatan tahun 2020 dengan jumlah pengurusnya 6 dan jumlah anggotanya ada 60, yang lansia ada 37. Seperti KLG yang lain, kami juga melakukan kegiatan-kegiatan, yaitu adanya peningkatan kesejahteraan untuk anggota KLG itu sendiri, juga pemberdayaan lansia, dan juga ada dalam bentuk cek kesehatan ya. Cek kesehatan ini dilakukan pada pertemuan bulanan. Ada cek kesehatan, ada tensi, tentunya dengan prokes ya. Dan kita juga sharing ya. Adanya juga pelatihan-pelatihan, di mana pelatihan waktu itu kita latih dalam membuat telur asin. Ada pinjaman mikrokredit ya, itu sebagai penguat ya untuk mendukung kegiatan sosial. Sebelum pandemi, beberapa KLG ini terlibat dalam kegiatan pengurangan risiko bencana, di mana kita dilatih dari Badan Penanggulangan Bencana Daerah dan juga tingkat nasional dalam kegiatan Desa Tangguh Bencana, menjadi Sri Kandi Siaga Bencana, dan juga menjadi kader rujukan ya. Kader rujukan ini jika ada kekerasan di dalam keluarga yang ada lansianya, maka kita perlu adanya mediasi, lalu dengan musyawarah, dan ini akan menghasilkan kebersamaan penyelesaian yang tepat. Dalam KLG ini juga kita mengidentifikasikan anggotanya ya, yang memerlukan bantuan mungkin kursi roda, maka segera kita membuat permohonan ke dinas sosial. Sejak COVID-19 terjadi, ini kegiatan KLG itu berhenti sesuai instruksi pemerintah untuk mengurangi penyebaran COVID-19. Karena lansia merupakan kelompok yang rentan terhadap virus tersebut, sehingga kami harus benar-benar berhati-hati untuk beraktivitas dalam mengikuti prokes yang harus kita terapkan ini. Pada saat ini, Daerah Istimewa Yogyakarta ini dibentuk Satgas COVID-19. Ini untuk melakukan pengawasan, pendataan, mengadakan monitoring. Apabila ada warga yang mungkin bergejala, maka segera kita sampaikan yang terdekat dengan dukuh, baru ke tingkat kelurahan dan baru ditindaklanjuti. Di sini KLG juga berperan dalam membuat masker dan juga sudah membagi-bagikan kepada warganya. Demikian juga bahan makanan yang isman ya. Kami berusaha untuk mencari bantuan, kebetulan ada komunitas di tempat kami itu untuk mendata dari kelurahan itu ada berapa orang. Kemarin kami berusaha ada 90 paket ya yang kita bagikan ke warga yang isman. Dan di situ tidak hanya membagikan saja, namun kita juga mengajak untuk berolahraga dan juga memberikan sosialisasi vaksin. Mari kita untuk ikut vaksin, mumpung gratis. Di sini pun untuk vaksin 1 itu sudah hampir 85%. Dan juga untuk vaksin 2 itu sudah hampir 65%. Demikian yang dapat kami sampaikan. Wassalamualaikum warahmatullahi wabarakatuh. Salam sehat, sehat semangat.
Thank you for sharing in detail the DRR and COVID-19 response by Yakkum as well as the intergenerational groups. Next in my list of country sharing is from the Philippines. Can you show the video presentation from the Philippines?
Everyone, I am Agustinus Coli, the DRR focal person of the Coalition of Services of the Elderly, or COSE. I and Ms. Paz Vasconcelio of the Confederation of Older Persons Associations of the Philippines, presenting to you the role of the Older Persons Associations in DRR and COVID-19 response in the Philippines. Our presentation will be in two parts. The first part, I will be introducing COSE, especially how COSE has been working with older persons in strengthening the role of their organizations in DRR and COVID-19 response. For the second part, Ms. Paz Vasconcelio will be presenting to you how their organization has played an important role in DRR and COVID-19 response. So let's start with the first part of our presentation. The Coalition of Services of the Elderly, or COSE, is a non-government organization in the Philippines working with older persons since 1989. We focus on the formation and strengthening of older persons organizations, advocacy, and partnership building. We promote community-based programs of older persons such as healthcare, residential care facility, age-friendly and diversified livelihood, and inclusive disaster risk reduction and management. The following are key strategies for COSE to realize its vision, mission, and goal. The first key strategy is community organizing. We facilitate the formation and strengthening of older persons organizations and the establishment of community-based programs of older persons. The second key strategy is capacity development. We strengthen the capacities and enhance the knowledge and skills of leaders and members of the OPAs in organizational and program development. The third key strategy is advocacy and lobbying. We push for the legislation of policies that promote the rights and well-being of older persons, and we call for better implementation of the existing programs and policies. And the last key strategy is networking and partnership building. We partner with various stakeholders at the local, national, and international levels to advance the well-being of older persons. The following are the strategic focus areas where COSE is working on. The first strategic focus area is protection and inclusion. We promote the rights and welfare of older persons through policy advocacy and awareness raising of issues and existing laws and policies related to older persons. The second one is active and healthy aging. We promote healthy and active aging through community-based health programs. And the third one is income security. We advocate for the establishment of policies and programs that guarantee income security, including age-friendly livelihood. And the last strategic focus area is community resilience. We ensure the participation and inclusion of older persons in community DRR programs and activities. We promote inclusive community-based disaster risk reduction and management activities led by older persons themselves. And since 2010, disaster risk reduction and management becomes an integral part of the programs of COSE. COSE was involved in rapid needs assessment and emergency response activities in various past activities by implementing relief operations, cash transfers, recovery and rehabilitation intervention. And most especially in 2013 to 2016, COSE implemented an emergency response and recovery and rehabilitation project in partnership with HelpAge International after Super Typhoon Haiyan, the strongest tropical storm ever recorded to hit the Philippines, which caused significant damages to livelihoods, key infrastructure, and basic services. It killed more than 6,000 people. Older people and other vulnerable people were greatly impacted by the massive destructions. COSE also has been implementing community-based disaster risk reduction and management or CBDRRM projects in 8 municipalities in Luzon and Visayas in 2016 to 2018 and in 12 municipalities in Mindanao in 2011 to 2013 and currently in 5 municipalities in the province of Agusan del Sur in Mindanao. The project started in November 2020 and it will end in October 2023. COSE has been advocating for the protection and inclusion of older persons in humanitarian as well as for their active participation in planning and implementation of community DRR plans and programs. Their representation in community DRR committees is important to ensure that their issues and needs are properly addressed at the community level. Though older persons have vulnerabilities, they have capacities to contribute to the strengthening of community resiliency. They have knowledge and experience which they can contribute to the development and implementation of DRR programs of the communities. And during this COVID-19 pandemic, COSE distributed immunopacks to more than 20,000 older persons in Metro Manila and nearby provinces. The immunopacks include nutrition items to boost immune system of older persons against COVID-19 virus. The items include vitamins, milk, oatmeal, and other basic food items. COSE also advocates for the prioritization of older persons in the vaccination program of the government. At the same time, encourage older persons to be vaccinated. And as you can see on this slide, this is part of our IEC materials on the COVID-19 pandemic. And so let's listen to the second part of our presentation.
I'm Paz Vasconcelio, Chairperson of the Board of Directors of the Confederation of Older Persons Associations of the Philippines, or COPA. COPA is a people's organization that pushes relevant policies, creates and promotes community-based programs of older persons to ensure that they become a proactive sector of this society. COPA was organized in 2006. It is composed of 18 federations with 114 older persons organizations from National Capital Region and nearby provinces. COPA get involved in DRR since 2009 when Typhoon Ketsana caused widespread flooding in Metro Manila, which resulted in the destruction of livelihoods, infrastructures, and properties. Many older persons were affected by that disaster. We are involved in rapid needs assessment and relief operations for the survivors of the disaster. Since then, COPAP has established a committee on DRR which leads in the advocacy for issues of older persons in DRR. The committee, in partnership with COSE and other civil society organizations, has been involved in capacity development and advocacy for the protection and inclusion of older persons in community DRR programs and in humanitarian interventions. After the Super Typhoon Haiyan hit the central Philippines, COPAP sent volunteers for psychosocial interventions with older persons survivors. Many COPAP leaders were also invited in advocacy activities, especially for inclusion of older persons and other vulnerable people in humanitarian interventions. In this time of COVID, we thou show solidarity with other members who are affected by the community quarantines by gathering donations in terms of food items and distribute them to affected members. We are also involved in the distribution of immunopacks spearheaded by COSE with donations from different donors. Thank you for listening to my sharing of how OPAs played an important role in DRR and COVID-19 response. Again, this is Paz Vasconcello of COPA.
Thank you. Thank you for the excellent presentation from COSE and also COPA for their very comprehensive program to develop and promote older people association in the Philippines, especially in DRR and also COVID-19 response. Next in the list of country sharing is from Vietnam. Can you share the video presentation from Vietnam? Hi, welcome to my presentation on the Intergenerational Self-Help Club, or the ISHC, and its community-based DRR and its response to COVID-19 pandemic. My presentation will be in 6 parts. Part number 1, who are we? HelpAge International is the secretariat to a global network of organizations working for the rights of all older people to lead dignified, healthy, and secure life. Our network has 148 members in 86 countries across the world. Part 2, population aging. Vietnam is rapidly aging and has one of the shortest transition periods from aging 10% to age 20%. In fact, Vietnam has faster aging than China or Japan. However, older people are changing. Current and future old are more educated, healthier, wealthier, and more dynamic than past generations. Older people of today and tomorrow is a large, growing, and valuable untapped resources for the family, communities, and the country's sustainable development. They should be included and invested. Part number 3, the Intergenerational Self-Help Club, or the ISAC Development Model. The ISAC Development Model is a development initiative that provides control of the development process, resources, and decision-making authority directly to the community groups. The underlying assumption of the ISHC development models are that the communities is the best judge on how their life can be improved, and if provided with adequate training, information, opportunities, and resources, they can organize themselves to provide for their immediate and long-term need and development. Moreover, the IHHC development model is motivated by their trust in people, and hence it advocates people's full participation and ownership as a powerful force for development. By treating people as an asset and partners in the development process, which will make the model more responsive to local demand, is more inclusive and cost-effective compared to traditional development models. The ISHC development model is cost-effective and affordable for low and low-middle income countries like Vietnam. It is attractive for young and old, men and women, poor and non-poor. It is dynamic, able to be replicated in rural, urban, coastal, and mountainous areas and in all regions of the countries. It is replicable, as evidenced by its rapid growth throughout the countries. It is sustainable, able to continue to operate and grow even after when the funding ends. It is multifunctional, which enables it to meet the wide range of needs and wants of both the young and the old. A typical ISHC has at least 8 core components or main activity grouping, which is based on the top need of its members and communities. Part 4, Mainstreaming Community-Based DRR in the Intergenerational Self-Help Club. HelpAge has developed 18 topics on community DRR, which are community and age-friendly. It has 20 first aid topics and has more than 300 pro-poor, age, and resilient livelihood topics. This is a photo of a group work from the community-based DRR training for the ISHC representative. This is a photo of a first aid training. Training of trainers, training the ISSC to become trainers. Disaster preparedness plan developed by the ISSCs and community representative. Community DRR map developed jointly by the ISSCs and local authority. The ISSC present the community DRR plan to the communities. The ISHC present their community disaster plan to the local government, conduct regular community-based DRR and climate change communication session or talk conducted by the ISHCs for the community. Community-based DRR and climate change community session conducted by the ISHCs for school students. First aid training conducted by the ISHCs for the communities. The ISHC using their own fund to support the local authority to make and set up early warning system. The ISHC used their own funding to purchase mobile sound systems to improve the community early warning system. The ISHC volunteer conduct regular home visits to provide information relating to community-based DRR and other local development. This is the ISHC emergency buddy system. This ensures the most vulnerable needs are being considered and taken care of before, during, and after an emergency. The ISHC community-based care service taps a large and growing number of people aged 50 to 69 years to become home care volunteers, which is especially important for during and after an emergency. The 50 to 70 ISC members per community can provide invaluable labor contribution to help vulnerable families before approaching typhoon, storms, or floods. The ISHC is very good at attracting wide range of donations within their communities. The donation can be in cash, in kind, or in labor contribution. The ISHC works closely with the local authority to support communities to prepare for the upcoming typhoon, storms, and flood season by reinforcing community infrastructures. The ISHC works closely with the community to prepare for the upcoming typhoon, storm, or flood season. The ISHC Pro-Poor, Age, and Resilient Livelihood component promote income diversity and resilient activities which lower member risk. Part 5. The Intergenerational Self-Help Club COVID-19 Response. To support the ISHC with their activity during COVID-19 pandemic, HelpAge International in Vietnam developed the COVID-19 manual for ISHC and local partners. To find out what were the ISHC COVID-19 intervention and their impact, HelpAge International in Vietnam conducted a rapid situation assessment. These were their activities. ISHC conducted rapid needs assessment of the most at-risk and needy households. The list is then presented to and certified by local authority for future relief support. Even though the government of Vietnam has numerous interventions to mitigate the impact of COVID-19, however, there were still many remaining needs and gaps. Therefore, the ISHC expanded their local resource mobilization targeting government office, private sectors, faith-based organizations, and individual donors. The ISHC representatives were invited to local COVID-19 coordination meetings. The ISHC were considered important key players in local COVID-19 control and mitigation efforts. The ISHC provided volunteers to man community checkpoints and recorded visitors' temperatures and information. Prepared meal service for staff and volunteers at community checkpoints, conducted regular COVID-19 communication and dissemination activities such as providing updates to stay connected with members through regular phone calls. 2. Raise awareness on COVID-19 through community loudspeakers. 3. Set up online chat groups to share COVID-19 information and provide door-to-door COVID-19 ISEC materials and encourage good practice. Supported local authorities and other organizations to conduct mobile information and dissemination. HelpAge International in Vietnam produces standardized COVID-19 message recording which the ISHC can use in their community loudspeaker information sharing activities. Mainstream new normal practice in the ISHC activities such as social distance, wearing face masks, hand washing, and regular temperature check. Support provincial health department to make liquid soap for distribution. Support local health department to conduct information sessions for trainers on the proper usage of face masks and hand wash with soap. Distribution of face masks and liquid soap. Distribution of emergency food and cash assistance to needy households. Provided special care package for older old and those that are frail. Provide information to care provider on how to protect themselves and their client. ISHC links with local commune health station and or retired health workers to provide regular medical checkup for their care client at home. Home care volunteer provide medical escort service to health checkup and follow-up treatment. ISHC also have social development fund which can be used to provide financial support to needy families to cover their out-of-pocket medical costs. The ISHC living support activity included shopping, meal delivery, running errands, house repair, and farm and yard work. ISHC regularly conduct environmental sanitation improvement in their community such as village cleanup, improvement, and disinfection days. Many ISHC also conduct their daily physical exercise online to promote stay active and healthy during COVID-19 lockdown. Encourage members to write and share poems and writings on COVID-19 prevention to boost positive thinking and localize COVID-19 message. To disseminate COVID-19 information widely throughout the country, HelpAge, in partnership with the Ministry of Health and UNFPA, developed a series of COVID-19 awareness and training videos, such as basic information on COVID-19 for older people, 10 things older people need to pay attention during COVID-19, how to protect older people in nursing home during COVID-19, care for older people at home during COVID-19, COVID-19 and older people information for family members, guidance on quarantine at home for older people during COVID-19, and COVID-19 vaccination and older people. Part 6, Voice from Older People. All the young people are working far away. The only one left in our communities are older people and the sick. This is the reason why when disaster happened, the village faced many difficulties. Every year, before the typhoon season, the ISC would conduct situation assessment on who is vulnerable in the community and develop plan. When a disaster happens, the ISHC already knows who they are responsible to help, and they can go directly to the home to provide the support that they need. When a typhoon comes, I will follow the instruction given by the ISHC. They come and help me to evacuate. I feel very grateful to get the support from the ISHC. Our household income is now around 3.5 million Vietnam dong or $175 a month. If a disaster hit, my tea field can withstand it, meaning we can still have our household income even if there is a typhoon. With the livelihood support from the ISAC, the member can develop and improve their family livelihood activities and make it more resilient to disasters. The HelpAge project building disaster-resilient communities in coastal Vietnam has trained and provide disaster preparedness skills for many vulnerable people, which are mostly older people and people with disability living in the north central coast of Vietnam. This is Miss Nguyen Thị Thanh. She is 74 years old from Tân Lộc Village, Hà Tĩnh Province. She lives in a very poorly conditioned house for many years. And during the typhoon season, her house would not protect her from the rain and storm. But with the support from the club and the communities, she now has a much better and safer house to live in. Thank you. Thank you, HelpAge International in Vietnam, and to sharing their intergenerational self-help club model in the countries and their activities on disaster risk reduction and COVID-19 response. Last in my list is the sharing from Thailand. So the floor is yours, Thailand.
ครับอ้าวแม่คุณไพแอคทีฟ
จะเป็นไม้ไผ่นะครับ
น่าจะเอาเขาก่อน
เรา
เนาะ
มาแบ่งกันแล้วเราไม้ไผ่มา
ให้พูดแล้วเหรอ ยังนี่
เดี๋ยวสไลด์เริ่มไม้ไผ่ก็เริ่มเลย
ให้เริ่มกันก่อนเขาเนี่ยเริ่มนะ
Okay, Thailand, you're ready.
พร้อมแล้วไปเลยเดี๋ยวนะครับให้สไลด์ขึ้นแล้วแม่ก็พูดตามภาพแม่อยู่ผมแปลนี่สวยงาม2 คนด้วยวันนี้
แสบ
มีเงาด้วย คุยแล้วครับไป
เอาเลยครับ
สวัสดีเลยนะ
เริ่มเลยครับไปเลย
คุยตามเซ็ก
สวัสดีค่ะ ดิฉันนางประภัยอมรศักดิ์จากครัวแม่อุ้ยจังหวัดเชียงใหม่แห่งประเทศไทยค่ะ
Good morning. My name is Prapai Amontak from Grandma's Kitchen from Chiang Mai, Thailand.
ครัวแม่อุ้ยในชุมชนหนองหอย ครัวแม่อุ้ยในชุมชนหนองหอยจังหวัดเชียงใหม่ ตั้งขึ้นโดยชมรมผู้สูงอายุ เพื่อช่วยในการบรรเทาความเดือดร้อนให้กับผู้สูงอายุครอบครัวคนในชุมชนและรวมถึงกลุ่มแรงงานที่ได้รับผลกระทบจากสถานการณ์โควิด -19
Grandma Kitchens at Nong Hoi Community Chiang Mai was established by Nong Hoi Older People Group to provide relief for older people, their families, and other community members, especially labor workers in the area, whom have been impacted by the COVID-19 pandemic.
ด้วยการสร้างความมั่นคงทางอาหารและแก้ปัญหาให้กับผู้มีรายได้น้อย
By creating food and meal stabilities as well as provide additional income for the unemployed and older people.
สร้างรายได้เสริมให้กับผู้สูงอายุและกลุ่มที่ตกงาน ครัวแม่อุ้ยเป็นโครงการโดยชุมชน บนแนวคิดคนทำได้กิน คนยากไร้ได้กิน และทุกคนในชุมชนเข้าถึงแหล่งอาหารได้
Grandma's Kitchen is a community established project based upon the idea that anybody involved can eat, anybody in need can eat, and that anybody in the community can exist. Individuals involved in helping can receive food as compensation for volunteering.
นั่นคือสมาชิกที่มาช่วยกันทำงานตามความถนัดจะได้รับค่าตอบแทนเป็นอาหารนำกลับไปยังครอบครัวตนเองคนในชุมชนสามารถเข้าถึงอาหารที่มีคุณภาพได้อย่างทั่วถึง
Community members are also able to access quality food via project involved shop at a low price, with profits being reinvested into the project. A main kitchen is also available to provide meals for families with older members, low-income people, as well as ill and disabled people in the community.
คือร้านที่ร่วมโครงการทุกร้านขายอาหารในราคาถูกขายอาหารในราคาถูกซึ่งกำไรที่ได้มาจะนำมารวมกันและนำกลับมาเป็นทุนหมุนเวียนรวมทั้งเป็นส่วนของครัวกลางเพื่อแบ่งปันอาหารให้แก่ครอบครัวที่มีผู้สูงอายุผู้ยากไร้ผู้ป่วยติดบ้านติดเตียงและผู้พิการ
Yeah, community members are also able to access quality food via project involved shop at low price, with profit being reinvested into the project. And main kitchen is also available to provide meals for family with older members, low-income people as well as ill people.
นอกจากนี้ครัวแม่อุ้ยยังมีการรับซื้อวัตถุดิบโดยซื้อพืชผักจากแหล่งปลูกในชุมชนโดยส่งเสริมให้สมาชิกปลูกพืชผักสวนครัวเพื่อสร้างรายได้ให้ผู้สูงอายุมีรายได้เสริมอีกด้วย
Aside from this, Grandma's Kitchen also purchase vegetables produced grown in the community to support homegrown producer as a form of additional income.
จากรูปแบบของการทำงานดังกล่าวทำให้ครัวแม่อุ้ยมีทุนหมุนเวียนสามารถดำเนินกิจกรรมได้อย่างต่อเนื่องโดยตลอดตั้งแต่ปี2019 จนถึงปัจจุบันทุกวันนี้มีครัวกลางที่ทำอาหารเพื่อแจกจ่ายมีร้านขายอาหารในชุมชนที่ร่วมโครงการ5ร้านและขายครั้งละ10 บาทและ15 บาทเท่านั้น
Using this project model, Grandma Kitchen has a substantial circulation of investment continuing since 2019, as well as a main kitchen that can provide meals and 5 project-involved stores in the community.
ทำให้คนในชุมชนมากกว่า350 ครัวเรือนที่เข้าถึงอาหารที่มีคุณภาพในราคาถูกและครอบครัวที่มีผู้สูงอายุผู้ยากไร้กว่า20 ครัวเรือนที่มีรายได้เสริมจากการปลูกพืชผักสวนครัวซึ่งเป็นวัตถุดิบให้กับครัวแม่อุ้ย
With this, 350 households now have access to quality food at a cheap price of only 10 to 15 baht per meal. With more than 35 households with older people, low-income conditions, disabled people, and ill people receiving meals each day, and another 20 households gaining additional income through home-growing produce for Grandma Kitchen.
เป็นการสร้างนวัตกรรมใหม่กระบวนการคิดแบบใหม่ๆถ้านำเอามาแจกเพียงอย่างเดียวก็จะทำให้งบประมาณหมดไปในระยะสั้น
This is accounted as innovative idea which can maintain and sustain the project to become more sustainable, because if the budget was spent at one time at the beginning, then the budget cannot be reinvested. But with this project, the project was able to reinvest it and become more sustainable.
ถ้านำเอามาเป็นกองทุนหมุนเวียนคือขายด้วยในราคาถูกก็จะทำให้เกิดความยั่งยืนได้
Which it can provide the cheap price for the local food for local people and make it more sustainable.
เราได้บทเรียนที่คนทำงานได้รับจากการโครงการครัวแม่อุ้ยคือ เราเปลี่ยนปัญหาให้เป็นปัญญาการเปลี่ยนทุกข์ให้เป็นทุนเปลี่ยนภาระให้เป็นพลังและสุดท้ายเราเปลี่ยนวิธีการให้เป็นวิถีชุมชน
A key lesson taken from working with Grandma's Kitchen project is the idea to change problem into wisdom, hardship into investment, liability into motivation, and plan into community lifestyle.
ซึ่งเป็นการเริ่มจากการเปลี่ยนแปลงมุมมองความคิดจากภายในสู่ความเป็นจริงภายนอกนำไปสู่การปฏิบัติในที่สุดผ่านการร่วมมือกันทำงานอย่างค่อยเป็นค่อยไปตามธรรมชาติของชุมชนจนกลายเป็นวิถีชีวิตใหม่ของคนในชุมชนต่อไป
This was done through changing ideas into reality, leading to practice through cooperation and sustainability within the community, which become the new way of life, the new way of more sustainable life in community.
ดิฉันขอจบการนำเสนอเพียงแค่นี้ดิฉันมีความยินดีมากที่ได้มาร่วมแลกเปลี่ยนในวันนี้และได้เรียนรู้งานของกลุ่มอื่นๆจากการนำเสนอของทั้งประเทศอินโดนีเซียฟิลิปปินส์ตลอดจนถึงประเทศเวียดนามและหวังว่างานครัวแม่อุ้ยจากประเทศไทยจะเป็นประโยชน์ต่อผู้อื่นได้ไม่มากก็น้อยขอขอบคุณและสวัสดีค่ะ
At the end, I'm grateful to be involved in changing the world around me today, and to learn ideas from other groups, including clients presented from Indonesia, Philippines, and Vietnam. And I hope that Grandma's Kitchen project from Thailand can be beneficial to the lives of others. Thank you and Sawadee Ka.
Yes, good morning to Mr. Mark, Kun Sawang, and Mr. Quinn, and all participants in this webinar. My name is Mr. Chan Yus. I was assigned to in charge to the program manager of FOPDEV, include and management of this DR program of FOPDEV since 2013 for 4 years. And I'm pleased to present on the FOPDEV experience in promoting the Thailand inclusive in disaster risk and COVID response in 3 following topics. Yeah. The first experience that we want to share is what are the FOPDEV experience on aging inclusive in the DR and COVID response. Since we get support from our Prudence Foundation 9 years ago. And the second is what are the successful working approach that we are developed up to now that can be able to promoting the and expansion of the OPA and community-based organization late mainstreaming the age inclusive on DR and COVID response. The third issue that would like to present about the progress achievements of the project since up to date. So for the first information about the FOPDEV experience, and we can summary for the 9-year experience like this. We have 2 phases that have getting work closely with get support from Prudence Foundation. The first phase during the 2013 and 2015, 3 years at that time. At that time, they have in-depth project called the building capacity on empowerment of the resilience in Thailand. So at that 3-year project have summary the key success is the first one the FOPDEV have start to get the in-depth what we call the age inclusive community-based disaster risk reduction model. And from that time, we have worked closely with HelpAge International to work as the ASEAN Partnership Working Group at the ASEAN level, and we propose this what they call the model, inclusive and community-based model to the ASEAN, and then we get the what they call the ASEAN Community Resilient Champion at that phase. Yeah. So after that, we get continued support from Prudence Foundation for the second phase during the 2016 and 2018 to move up from in-depth project to work more with the other CSO community-based network on the disaster risk reduction. So we have set up the project on the building network for the national disaster risk reduction platform in Thailand. At that phase, at the second phase, we have summary the key success. At least we move up our work with the community-based and CSO network on disaster risk reduction and create the network. And after that, from the project itself, we have a time to draw lesson learned and the best practice, about 10 best practice that include our model inclusive in disaster risk reduction, and then we have the other model from the other colleague that like a school, safe school model, and the network on disaster risk reduction, something like that. After that, second phase, we move to the third phase, that we are shift from the project-led implementation to be focused to be more technical support, provide capacity building, and give the capacity of the community itself to come to work on this inclusive disaster risk reduction. So from this phase, we have focused to promote an expansion of inclusive disaster risk reduction in Thailand, and maybe sharing to the ASEAN country. Yeah. So the next issue with discussion, especially that the FOPDEV have key working approach. We change from a project implementation, project-led implementation, to be more coaching and technical support to support the community to be able to mobilize their resource and get up to work on this community-based inclusive in disaster risk reduction. So the key process that we work is the first step that is to formulate the setup management committee to manage the activity on capacity building and manage this sub-grant fund to implement their project. The second one is after we set up committee, and then we will more or less open the call proposal from group, OPA group, and community organization and CSO network in our network, and also open to the public to submit their proposal to work on the community-based disaster risk reduction. Yeah, and the third step is after we open the call. So after that, we have organized, after we receive proposal, we organize a consultation meeting. Especially at this time, we apply the process of new approach on the design thinking process to be let the community group to be able to be have a one process, thinking process to get the good project idea and their own idea, and then within their capacity and resource and network to be able to design a good proposal and get support from our technical support and sub-grant to implement that project. The fourth step after we get work with the community and other person organization to get a good project, and we support them. But after that, we will also get a process of orientation of the people who are screened and select to get support the project fund sub-grant already in the term of in order to implement their project. After that, the project support the community with fund and technical support. They bring to implement their own project in the community. And then along the time of implementation, we also the project will provide technical support, coordination, and resource mobilization. After that, this more or less sub-grant will take maybe 3 to 4 months. After that, after they finish the implementation of this idea project, we organize a kind of peer learning, organize a kind of meeting together or learning according to the COVID and pandemic. So we sometimes we organize learning by online. The last step from all these piloting implementation of the community organization. So we bring this story of the successful community-based disaster risk reduction and sharing the information through our social media and best practices through our social media and include with some local interest mass media. Yeah, it's our successful approach that we be able to support to promotion and expansion of the inclusive in community-based disaster risk reduction. The last, I would like to share some of our success achievement, progress achievement during this first this phase 3. For example, along this phase 3, we at least have 16 community-based organization, include older person group, and CSO can be able to implement an expansion of the age inclusive on community reduction project. So we have a model. The first two projects is like Grandma Kitchen is led by the person group that work to respond and relieve the COVID response and relief. The other one on this case, we work with the community organized in the coastal area southern Thailand that also doing the community response. The other 8 successful case in the community-based disaster risk reduction. We are support them to be able to make what we call to make information vulnerable and information, which support a new approach on the new data use technology to get the older version and vulnerability data management that will use for to prepare the risk and preparedness for the community-based planning, include and use the data to be service on the help to the older person. The other successful case, we have 6 community-based organization, community-based disaster risk reduction that focus using the approach on food security and the natural resource management intervention in order to be able to be mitigate or prevention the risk for the disaster risk reduction also. The last one, we have some good case for working as a network with a network work on disaster risk reduction, that be able to work on this on the what we call risk communication, risk awareness, that especially for example we have a network in Chiang Mai that working on the risk communication through prevention and mitigation and reducing the risk from the air pollution, PM 2.5, something like that. This is our progress achievement today. Yeah, that all that 3 points of presentation. All of this beside the grandmother kitchen or the case, we have make a kind of documentation in terms of pictorial report or the photo documentation, include the video clip, and then is this all kind of this what we call the successful case, best practice, we are put into the social media. That can you can also it's make available on our social network. On the network. That I mentioned that all of this I mentioned about the successful case and explain of community-based disaster risk reduction. So we make into the photo documentation and e-documentation, and this already make available in our what we call the social media DRR net, and also include the Prudence Foundation website. Yeah, thank you very much. Yeah.
Grandma kitchen, and also more evolving DRR program from direct implementation to sub-granting. Maybe Thailand, you can turn off your microphone.
Yep.
We have just completed our 4-country presentation, and now we are in our Q&A session. So if you have questions, please write your question in the chat box or raise your hand and name the country you are directing your question to. So let me see what is in our chat box. I see one here from Indonesia. It said, it is so interesting how many food packages are distributed daily. I think this is referring to Thailand for the grandma kitchen. So Thailand, can you respond?
เราสามารถจ่ายให้บ้านเราประมาณ
100 ถึง 200 ชุด
about 200 about 100 more than 100 to 200.
Okay, from 100 to 200 packages per day.
Per day, yes.
Very good. Okay, thank you.
It will take one or 2 months, nah? Yeah. To distribute the food.
Okay. Other questions? Any other question? If not, I will go to the Facebook and YouTube to see if there's other questions.
Can I put some question, Mr. Brin?
Yes, from Thailand. So what is your country?
Maybe I interest the question to COPAP. COPAP because COPAP is a big organization of older person in Philippines, and I just want to know what is now the challenge for the COPAP to expansion or to promote the age inclusive of older person. What is the main challenge for COPAP to be promote or expansion the age inclusive in DR in the country?
Right now, the challenge of the COPAP people is how to educate the older
Thailand, can you turn on your microphone? Okay, go ahead.
Uh, our challenge right now is how to educate our older persons on how to on how they could cope up with the COVID-19. Then right now, only 60% of all the people have been vaccinated because we have a problem regarding the availability of vaccine. Then the challenges that we do have is they cannot go out of their house because of very strict implementation of our health protocol in the Philippines.
Yeah, just to add, one of the challenges faced by the older persons organizations in the Philippines on age-inclusive disaster risk reduction activities, I think there is the attitude of like looking at the older persons as the main recipient. So the participation actually until now we're like advocating for the inclusive disaster risk reduction in the country. Though we have a law, but because of the ageism, discrimination based on age, and they look older person as the weak and also like they cannot contribute, but through the they can but through the efforts of OPA, it has been shown to the government and other partners, stakeholders that they are still capable, they're very active, even during the COVID-19 pandemic. They collect donations from their members and distribute it to the most needy older persons. So I think that's it. So more on the how the government influence more to see older person are still capable of doing things, especially in disaster risk reduction and COVID-19 response.
Thank you, Kopa and COSE, for your response. Interesting about ageism, and that is a big barrier for the inclusion of older people in disaster risk reduction and over also COVID-19 response. Does other country have similar problem, and how do you overcome this ageism where people think older people are a burden, are passive, or charity cases, are not able to really play an active role in DRR response or COVID-19? It's open up to any country, Vietnam, Thailand, or Indonesia.
Question, please. Can you repeat?
Can you rephrase the question?
The question is basically like COSE say is that ageism is a big problem because so that's why many DRR and COVID-19 response are not inclusive of older people because they see older people as frail, as needy, as charity, not as a development worker, not as development action. And so basically, do you face the same problem in your country? And how do you overcome this? And this one is directed to Thailand, Vietnam, Indonesia as well. So Vietnam, how do you overcome this?
Thank you. In Vietnam, I think the best way is to demonstrate. We just let older people do it and then invite others to come and see. And once they see it, they will change their mindset. Actually, before the intervention or before the ISSC model, we do some initial survey. And yes, ageism is there. People just see older people as like passive recipients. needy people, and then they need to support them. But after the ISSC and other people do the intervention, we invited the local partner, the government to come and visit again. They totally changed their mindset. They say, oh, older people are the resources. They are very responsible. They are very hardworking, and they can contribute a lot. And if we involve the older people in DRR and COVID-19 prevention, then it's a win-win for everyone. And I think just do it first, and then invite the people to come and see, and then they will change their perception. Of course, and when we have the successful pilot, we need to do the evaluation, and we need to do the documentation, good documentation, and do IEC material to disseminate this out. But I think the best way is to see it, feel it.
Thank you. So it reminds me like the saying, a picture is worth 1,000 words. So demonstrating that older people are not as frail, or as dynamic, or different from what people are thinking is a very powerful tool. How about Indonesia? Do you have similar problem, and how do you overcome it?
Ya, bisa. Untuk di kalangan kita itu ya mari kita ajak lansia ya terutama yang sudah masuk di KLG sehingga mereka memiliki keterampilan-keterampilan, mungkin dia bisa menyalurkan dan juga ide-ide, karena orang tua itu biasanya punya ide yang tepat ya karena sudah pengalaman, sehingga lansia di sini diharapkan tidak hanya sebagai lansia yang sudah tidak berguna, tetapi tetap kita angkat agar lansia untuk berproduktif.
So basically, one of the way is to support the intergenerational group or the OPAs in the community. So it becomes the space for the older people to contribute based on what they based on their skills, and they able to raise up their voices, because when they together, the voices has become stronger, and all the people can be more productive.
Yes, thank you. Thailand, do you have any response to that?
Yeah, maybe Kun Papai will have some contribution, I think. And after that, I will have
ของ
some
ของ
contribution.
ประเทศไทยนะคะ เราพยายามอย่ามองผู้สูงอายุอย่างมีวยาคติกับผู้สูงอายุ เราปรับเปลี่ยนมุมมองใหม่ ให้ทุกคนมองผู้สูงอายุอย่างไร้วยาคติ ดึงเอาผู้สูงอายุเข้ามาร่วมทำงานได้ แม้กระทั่งสถานการณ์โควิด เราก็มีการไปปลุกระดมหรือรณรงค์เคาะประตูบ้าน แจกเอกสารให้ผู้สูงอายุติดบ้านติดเตียง ได้ผู้สูงอายุที่ป่วยเป็นโรคเรื้อรังให้เข้าร่วมฉีดวัคซีนนี้ได้
we're working through by trying to change the attitude of the local people in the community to the way they look into the role of the older people in the community. We have to make them see that the involving the older people in the community to work together, it will give the more benefit to the work of the community. And we work from door to door. We also provide dissemination of the knowledge and understanding among the community members, as well as among the older people themselves to understand the situation. So we're working on the local community level mostly.
ค่ะผู้สูงอายุลุกขึ้นมาทำงานในส่วนนี้นะคะรณรงค์ให้ต่างด้าวคนต่างด้าวที่เข้ามาอยู่ในชุมชนให้เข้าถึงวัคซีนนะคะทั้งหมดที่อยู่ในชุมชนให้ได้ฉีดจนครบนะคะเพราะว่าเราจะไม่แบ่งชนชั้นและก็วรรณะเราเข้าถึงทุกๆกลุ่มค่ะ
By working through the inclusive approach, we also have older people in the communities, working to help other people in the community, to make them beneficial to the other people, especially the laborers or the laborer who affected from the pandemics, also being helped by the local older people groups. So they all work together in the community.
ผู้สูงอายุต้องอยู่อย่างมีค่าชราอย่างมีคุณภาพนะคะ
Speaking for older people, myself, we must try to spend our life and live healthily, with healthy work, living lifestyle, and also with capacity and pride.
ซึ่งทุกคนอาจจะมองเห็นว่าผู้สูงอายุเป็นภาระแล้วก็พึ่งพาผู้อื่นอยู่เสมอแต่พวกเราต้องลุกขึ้นมาสู้กันเองจนได้ตั้งครัวแม่อุ้ยขึ้นมาโดยการนำเสนอของผู้สูงอายุที่เราคิดนอกกรอบถึงได้มีนวัตกรรมใหม่ขึ้นมาค่ะ
So as a older people myself, my comment is for all the older people to get up and try to work yourself and try to propose to the community. Even though we might be perceived as the dependent part of the society in the community, however, we having capacity to help the others, and by thinking out of the box and thinking innovatively, we can help the community. We can contribute the good part to the community. So I support all the older people to come and work together.
ค่ะโดยนำเอาภูมิปัญญาของผู้สูงอายุที่มีออกมาผสมผสานกับความรู้และประสบการณ์ที่เรามีอยู่ทุกวันนี้เพื่อจะให้คนทั่วไปเห็นว่าผู้สูงอายุเรามีพลังแล้วก็ไม่ได้เป็นภาระแก่บุคคลใดซึ่งหลายหน่วยงานจะมองเห็นว่าผู้สูงอายุเนี่ยเป็นภาระแก่ประเทศชาติหรือเป็นภาระแก่บุคคลอื่นแต่เรามองเห็นว่าต้องลุกขึ้นมาต่อสู้เพื่อรบคำสบประมาทเหล่านั้นค่ะ
Older people have to live with pride, and by using that valuable experience and wisdom, together with the new way of life, with technology, I am pretty concerned and sure that older people can provide beneficial to the community.
เรามีการปรับวิกฤตนี้นะคะให้เป็นโอกาสกับพวกเราได้คือรณรงค์ให้ทุกกลุ่มวัยไม่ว่าจะเป็นครอบครัวผู้ปกครองเด็กและก็เยาวชนผู้สูงอายุเข้ามาร่วมในการปลูกพืชผักสวนครัวซึ่งขณะนี้พืชทั้งหลายเนี่ยขาดตลาดไม่มีที่จะขายถึงขายก็ไม่ได้ไปซื้อเพราะตลาดทุกตลาดติดโควิดกันปิดกันทั้งนั้นพวกเราจึงเป็นโอกาสที่ชาวชุมชนของเราไม่ขาดผักเหล่านี้เราจะปลูกกันแล้วก็แจกกันนะคะแล้วเอามาขายให้ครัวแม่อุ้ยแล้วก็ผู้สูงอายุเหล่านั้นก็ยังได้มีรายได้ที่จะช่วยผู้สูงอายุกลุ่มเหล่านั้นได้ค่ะ
We also have to work innovatively and take the chance, take the opportunity. For example, like here in the grandma's kitchens, we having the constraint about the food security. We also get up and try to convince older people in the community to grow their own vegetables that we can use in the grandma kitchen. And this is the opportunity for people to make additional income. This is for example.
So thank you for sharing. We have so many questions in our chat box and various chats, but we have limited time, so we would now want to move on to the third part. But there are many questions. I would like you to, after this webinar, to contact directly to the countries and the questions you have, and I think that will be building a long-term relationship between our partners in the region. So now we are in part 3, which is way forward to promote age-inclusive DRR and emergency response in your countries and what you propose for the region action. Okay, so the first country I would like to invite maybe is from Indonesia. What are you planning to do and what are you proposing?
Yeah, thank you. Can you hear me?
Yes, good.
Gwen?
Yes, good, good.
Hello?
Yes, we can hear you very well.
Okay, so the way forward from Indonesia is older people association with intergenerational approach need to be established, strengthened, and involved in leadership and decision-making position in disaster risk reduction and response coordination at all levels. Active involvement of older people association in humanitarian coordination mechanism such as in emergency cluster. Second is utilize and update disaggregated data of older people digitally and in stages starting from local community at the smallest level, sub-village, to national, and provide opportunities for public to access when needed. Third, identify existing budget items that have opportunities for inclusive disaster preparedness funding. Additional budget or support should be sought to ensure the active involvement of older people, such as reasonable accommodation for promoting accessibility, support for caregiver, and etc. And then provide inclusive and accessible media information on disaster preparedness and space for older people in sharing their experiences and knowledge on disaster history. And then the last, strengthening multi-stakeholder support from the government, private sector, faith community, academic, NGOs, in an effort to improve the protection for older people in every stages of disaster management. Thank you.
Do you have any recommendation for the regional activities, regional sharing and learning?
Yeah, I think our recommendation not only for national but of course for regional and global. So we expand the coordination not only national but also regional sharing and knowledge and is important.
Okay, thank you very much. Next, I would like to invite our friend from the Philippines. Yes.
Yes. Yes, good morning, everyone. So actually, our ways forward or recommendation is divided into three parts. Can you share the presentation, Jane? Okay, it's divided into three parts at the community level, national level, and the regional level. So at the community level, COSE will continue to strengthen the older persons associations capacities to be actively involved in DRR. So one of our initiatives in partnership with the local government units in the Philippines is the promotion of inclusive community-based disaster risk reduction and management. And since our partners are the older persons, in this project, we ensured the participation and involvement of the OPAs from disaster preparedness, prevention and mitigation, response and rehabilitation and recovery. Then second, at the national level, OSE and our partner OPAs, COPA, will focus on policy advocacy, particularly in amending the existing DRR law. We have existing law in the Philippines that mandates the strengthening of the Philippine Disaster Risk Reduction and Management and providing the National Disaster Risk Reduction Management Framework and institutionalizing the National Disaster Risk Reduction and Management Plan. But there are gaps in the implementation of this current law. And we would like to have an amendment on this law to focus more on the inclusive disaster risk reduction, like implementation of the community base, wherein the most affected sectors or groups, including older persons with disabilities, are included, no? in those aspects or different pillars of disaster risk reduction. And third, at the national or at the regional level, COSE and COPAP support the proposal for an exchange visit that involves OPAs, the private sector, and government official. And hopefully the pandemic will end soon so that we can have the face-to-face gatherings wherein it's better to talk directly to the experiences of older persons where we can learn from each other. And lastly, COSE also proposes a comparative research study on OPA's involvement in DRR in different ASEAN countries, highlighting the good practices of different OPAs in ASEAN countries. The result of this study can be used for our policy advocacy, program development, and can be replicated by other countries. So that's all. Thank you so much.
Thank you from our friend from the Philippines. Next, from Vietnam, please.
Yeah, I'd like to just share, not using video. I think for Vietnam, the HelpAge International in Vietnam will work very closely with Vietnam Association of the Elderly. That we have the 4 participants attend the webinar today together with me. We will continue to do policy advocacy for the full inclusion of older people in DRR. Currently, HelpAge in Vietnam and Vietnam Association of the Elderly are drafting the policy brief, targeting the government at all levels, and UN and INGO and private sectors for full inclusion of older people in CBDRM, community-based risk disaster reduction. The reason is in Vietnam, we have the national program of the government on CBDRM, community-based DRR. However, the older people is just mentioned as the recipient or needy people. The role of older people, the contribution of the older people is not clearly highlighted. So now we are like gathering all the evidence, showing our model, and then advocate different stakeholder for the full inclusion. So that is is ongoing, and we will continue in the coming month. The second, Vietnam Association of the Elderly, with the technical support from HelpAge International, is now drafting the joint collaboration program with the government steering committee on DRR. That is very big change resulted from HelpAge and VAE project on inclusive DRR. Funded by USAID, and we work in the consortium with the other 4 INGO in Vietnam. As a result, when they see in the role of older people, the government now discussing the joint collaboration program with the VAE. And HelpAge, we are happy to provide technical support during that process. Third, we HelpAge International and Association of the Elderly will continue to integrate DRR and COVID-19 into the existing system of ISSC. As you know, now ISSC is already replicated nationwide. We have more than 3,500 ISSC in all over the countries. And in the next 5 years, government already set up another 3 new ISSC, meaning that by the end of 2025, in Vietnam, there will be nearly 7,000 ISSC. And currently, we are working with the government to continue to put a new target of ISSC in the next 10-year National Plan of Action on Aging, with the new target that at least 50% to 70% of the communes in the country would have ISSC. So once we already have a massive number of ISSC, and then we continue to develop the guideline to mainstream DRR and COVID-19 into ISSC. So that is the way we are doing, and we continue to do it, replicate it in the coming months. We already developed some guidance, and that needs to be improved to be better. One or two recommendations for the regional event. First, I think that kind of event is very useful. Each of the country, we have a very good model, but when we listen to other friends, other countries, we can learn a lot. So I think it's very good if we can have the similar webinars, workshops, or field visits to learn from each other for cross-learning and sharing. And I think that the documentation of best practice with the lesson learned from each country is very useful. And then we can share with each other through that kind of forums, so that we can learn from each other. It's not just only 2 hours webinar, but I hope that we can have the field visit if the COVID-19 allows us, or other more bigger scale activities. And I think policy advocacy is very important at regional level as well, ASEAN level as well. I think we do a lot of work, but I hope that kind of important forum will invite or involve the government or the other donors or INGO or UN organization to hear from us. It's not only us to learn and hear from each other, but other to join us and learn and listen to older people. And Older People Association to know what we are doing, what are the best practice, and what they can do to support us, and what we, OPA, can support them. So how we can work together. So that is my, I think, Vietnam recommendation. Thank you.
Thank you, Vietnam. Last on our list is Thailand. Can you share your next step?
Yes, for Thailand, we have the way forward that we think that we want to promote Thailand still inclusive in disaster risk reduction and COVID response at the national, local, national level. That at this time, at this phase of project, the third phase of project, we are being to draw and collecting our lesson learned, the best practice, and maybe we have get an idea to develop the next step of the project, and then we'll continue implementation on this age inclusive, on this risk reduction and COVID response in Thailand for the next phase of the project. Besides that, we also have an idea that maybe because of we are already a 9-year experience to have a lot of what we call the knowledge and knowledge and best practice, and we plan to think to develop more or less like communication and training platform, something like that. So can be able to provide this platform for continue sharing, learning, training, and also use that what we call the best practice and the case like that to advocate to the public. The third, the new idea, because of the situation of the funding is not available for what typical the project itself now. I think there are now a new something like a social enterprise. So we think that maybe we have an idea to pilot something about for especially on the what we call maybe to organize to develop a kind of social enterprise to working on the what the eco cultural tour activity the support and led by older person and community organization, something like that. For the regional level, for the regional, for the recommendation for regional, maybe I still thinking that we should have support to continue a kind of discourse share learning, or even if we should have provide some kind of communication platform that we can share, because now there are a lot of social media that we can work, make together. Second, maybe I will support, cooperate with HelpAge and your and this what you call ASEAN network partner to make some project together, multi-country project, to be able to us to make a sharing experience together and also advocate the older person inclusive in the disaster risk reduction and COVID response.
Okay, thank you, Thailand. All of your comment, all of your suggestions, all of your plan has been recorded, and so will be included in this event reports. In general, basically, I have here four. One is that you will continue to support the OPA to play a major role, an important role in disaster risk reduction and COVID-19 response in your countries. Also, you will also focus on policy advocacy to ensure that older people, especially OPAs, are fully included, not just as beneficiary, but also as key players, actors in implementations. For the regional recommendation, one was that regional cross-learning and sharing event, including OPAs, network members, private sectors, and government to share. There's a lot of learning and sharing, and that's very, very beneficiary. Another one for the region is also maybe suggesting doing research and studies to highlight, to have evidence on the impact, and using that evidence for policy influencing and other things like that. So that is our conclusion for part 3. Now we are entering part 4. And so we have finished part 1, which is the welcome and introductions and objective. Part 2 is the country sharing. Part 2 is the next step. Part 4 is the clothing. And so I would like to invite back Mr. Sawang to give a closing remark.
Good morning again. This is Sawang from FOPDEV. I'm very pleased to be with you and to hear from you from the various idea focus on aging issues this time. And I think the most important thing in, as you can see, current situation of the aging population aging in this region, I would suggest in here before we close the empowerment of the OPAs to this is very, very important that support them, provide their opportunities to contribute to society, especially for older people who are disadvantaged or the vulnerable group in their community or in their society. I think if we promote them, provide them opportunity because they are resources, because they have a lot of experience along their life. So they are not no longer burden of the society unless the those who are bedridden or homebound. So I think this is very good opportunity that we all get together, not like the all members of HelpAge International, but partially, but it is very significant organizing this kind of activities. We start from like they are facing on the disaster in everywhere in our countries, and I think for other issues like poverty reduction and human rights, like a friend from I think Philippines that mentioned about ageism. And ageism is everywhere. I think everywhere in the world, in this region, and Thailand is no exception. So I would very much like to thank Mark again to support us, to Mark, I mean the Prudence Foundation, that to help us, to support us, to help the older people help them to help themselves as the key word for this. So I hope regionally by HelpAge network we can work together more and more in near future. If we cannot get together in like on site, but online, we can work on that. And this is very important to educate the older people of digital literacy. This is the key, and then we can get together. So, in conclusion, again, thank you very much for gathering virtual seminar on aging issue through time, especially the disaster risk reduction. Thank you very much.
Thank you, Mr. Swang. But before we end, I would like to ask Mr. Mark, after hearing the country propose action in their country as well as the recommendation for regional activity, what is your reflections, if any reflections or comments?
No, great sharing. It's great to have this platform and host this platform and create a community around the NGOs that are focused on this issue and share best practices and learnings, and hopefully that will lead to greater collaboration, greater best practices, greater sharings, greater inclusivity, less ageism, better programming, not just from people specifically looking at the aging population, but actually at community levels, and ensuring that all aspects, all spectrums of society are included in plannings, especially around DRR, and the lessons we've learned in COVID, where the aging community were extremely vulnerable, and there needs to be a lot of action taken around that. So now I look forward to all your successes going forward, and I look forward to more collaborations like this, and hopefully all the various ideas that you've brought forward and how you see the future over the next couple of years unfolding in each of the actions and the jobs that you guys do happens and materializes. So I look forward to sharing that and participating in that journey. But thank you very much for putting this together. It's been fascinating.
Thank you, Mark. Thank you, Mark. Thank you also for your foundation support, which made it possible for this webinar. So it has been a very fruitful 2-hour plus webinar. I hope the webinar have met your expectation and look forward for more regional sharing and learning. So thank you, be safe, and goodbye.
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 Bye.
Thank you.
Bye.